Florence Nightingale's biography when I was probably 8 years old, and always looked up to her and always wanted to become a nurse. After reading that, I love people and love taking care of people. So it's natural to me. I mean, it's different now. It was back in the 1800s, of course, on a battlefield. But the care and compassion that she gave was what I loved about her. And I also liked her fight to get, she started the hand washing in between surgeries and stuff. And back then it was pretty tough. She was a tough lady. So I admired her.
My story is different than everybody's. I'm the only nurse in my family. Still the only nurse in my family. I went to nursing school because I had an experience that was horrible with a nurse when my second child was born. And then I had an experience when my third child was born that was absolutely fantastic with the nurse that I was interacting with. Decided that it was something to look into, and so I took a job in a nursing home to see if I can deal with sick people, taking care of people, and I loved it. So I did that when I was 35.
I got into nursing because I was at a dead-end job and developed a company for 12 years. I went back to school when I was 35, graduated when I was 39. It's something I've always wanted to do, but I wasn't ready out of high school to go to school. I never matured a little bit. But I just like being with people. This is a different setting since I'm old ER setting. One thing I like about this wound center is I actually get to see my people heal. And at the ER, you just ship them out and you move on to the next one. So I found that very interesting about being here at the wound center.
I was inspired by my grandma. She was a nurse. She was tough. So I guess I've always that's the only really job that I had has been in the medical field. So I enjoy it. Like Julie, I enjoy the people. I love to help. I love to see things heal. I've had a lot of opportunities, especially in this hospital. Last 15 years, and a lot of pushed to do different things. Never really a bedside nurse, but in the specialty. So I've been blessed to have some options and learned a lot. So.
Similar to Chris, I wanted to find a purpose, I think. I went back to school, second degree. I wanted to open up some more avenues.
Similar to Julie, I didn't know Florence Nightingale, I don't think personally through a book or anything, but I'd heard someone say something about a lifetime giver of care. And whether you're a parent or a caregiver in any way, I always thought that was so respectable. And kind of that take your hand regardless of who you are. So kind of sappy, and I've always been a good listener, so I like the bedside nursing a lot.
Yes, mine was inspired by long family history in the medical field. My grandfather was a doctor, my grandmother was a nurse, and siblings, cousins, aunts. Just kind of followed that path. That was really inspiration for me.
Our patients. We get to know them. They come every week. They introduce us to their families, their lives. Some of them become friends. Sometimes they get better and stay away from us for a while, and then chronic illnesses, so they come back to us.
I think our providers too, between us and the providers, we're like a big family down here. And we just kind of take these patients and call them our own and take care of them until they're healed or whatever. But it's a group effort, and we work well together, do it together to get it done.
And I think the thing that keeps coming up, the theme is always the patients. This is a team that regardless of who's having a bad day or whatever's happening in life, the patients come first. I've seen socks bought, food bought, things bought for patients, brought in, caring beyond what I can even mention in this room. We have patients that yell nurses' names through the parking lot, and just there is a, because because the nurses' caring is evident, and it shows through our patients and how they interact with the team.
I can speak for everybody here. We make them feel important. Some people have been dismissed by society, but it doesn't matter your financial situation, what you look like, what clothes you're wearing. If you're here, we're going to take care of you just as well as we're going to take care of the next person. We don't see beyond that. You're here for our care and we're going to do the best we've got.
We do have numerous patients that are no longer current or active with us that stop by and say hi. And it's lovely.
Or still bring a tray of Christmas cookies, and they haven't been here in a long time.